Now this course will deal with angiogenesis that has occurred after thermal ablation. You will see that there's a characteristic pattern in the medial aspect of the thigh where most of these occur. Now this patient presents 2 months post-thermal ablation with these spider veins located on the medial thigh and just over the knee. She thought these were bruises, however this is angiogenesis. This is about 2 months after having a thermal ablation from mid-thigh inferiorly. Patient had a previous thermal ablation about 3 years ago. Now, people that develop recanalization or perforator pathology after thermal ablations are much more prone to develop angiogenesis. Now, the hallmark of treating angiogenesis, which is an inflammatory process, is to treat these spider varicosities. If there's inflow, you treat the reticulars as well as the spiders. Always do tumescent, as we're going to show you in this video. Now you'll see right here a little reticular vein coming up. You see all these spiders. Look down here again, a little reticular vein. So we're going to inject this with some 0.1 foam. 0.1 foam. Do the spiders and put tumescent underneath them. This is angiogenesis following a intravenous ablation and foam sclerotherapy. Sometimes this happens. She's had a previous treatment to the vein in the past too, so she's prone to do this. Okay. We're injecting 0.1% sotroductal foam. You can see it coming out of the little area we did here. This proves they're all connected. So we're going to fill up all these we can with dilute foam and do tumescent. And we'll show you in a minute after we've done that. So here's a reticular vein here. You can see this complex here. A little stick. We're going to go in right here. We're going to try to fill up the complex if we can through this reticular. This is 0.1% sotroducal foam. Good blood return. So now we're injecting. You can see some now going in here. Okay. Now this is the appearance of the spider reticular veins after we have injected 0.1% sotroducal foam into both the reticulars and into the spider veins. Now, liquid could also be used, liquid 0.1% sotroducal or 0.33% polydocanol. However, we chose foam, which we do quite often since this causes more intravascular damage and seems to lead to a quicker resolution. Now, when you inject foam, we have not seen angiogenesis get worse, except in one patient. However, this is very rare. Most time, foam is well tolerated in these spider veins. Now, the tumescent can be injected before or after the sclerotherapy. The choice is yours. If you're not sure about your sclerotherapy techniques yet, you might want to wait and do the tumescent after you've done the sclerotherapy, since sometimes it's hard to do sclerotherapy after infiltration with subdermal tumescent. Now, this is the appearance after doing the foam sclerotherapy. At this point, we're doing subdermal tumescent. You can see on the left that the spider veins, some of them are barely visible, others are somewhat edematous, but not clotted. Hence, there's no need to flush here. Now, I saw this patient acutely and her vessels were small and red. I would do tumescent first and see her back in a month. But since these are quite dilated and have a lot of blood volume, I decided to treat this when I first saw her. She'll get a better result quicker.